Of speech was on pain pill addiction. We all know that we have a huge problem with pain pill addiction in the United States, but there are many people who do require pain medication to treat their chronic pain issues. According to the AAFP, chronic pain affects approximately 1/3 of U.S. adults, and 5% of those receive opioid treatments. Strong narcotics are prescribed in up to 9% of all office visits. Until the 1990s, physicians generally limited narcotic treatment to patients with acute or cancer-related pain. However, studies showed that all types of pain were undertreated. As a result, pain education, advocacy, and policy initiatives led to an increase in prescribing narcotics for patients with chronic pain, non-terminal pain issues. Chronic pain is different from acute pain and must be approached differently. Acute pain is a symptom that plays a functional role in body defenses and resolves with tissue recovery. It is transmitted along intact neural pathways that are effectively treated by narcotics to decrease the pain perception. Chronic pain has no functional role, does not resolve with pain tissue recovery, and can become a primary diagnosis. Chronic pain involves complex central nervous system signaling that can be amplified by stresses such as relationship issues, financial problems, or underlying psychiatric diagnosis. Pain management is very important, and if done correctly by the patient and the doctor, it can be easily and safely managed. A pain management specialist is a physician with special training in evaluation, diagnosis, and treatment of all different types of pain. There are different ways to treat pain issues: surgical procedures, medication management, physical therapy or chiropractic therapy, psychological counseling and support, acupuncture, and other alternative therapies are all options as well. According to the U.S. National Library of Medicine, you should not use a narcotic drug for more than 3 to 4 months unless you are under direct care of your provider. Always take narcotics as prescribed. Your provider may suggest that you take your medicine only when you feel pain, or your doctor may suggest you take a narcotic on a regular schedule. Allowing the medicine to wear off before taking more of it can make the pain difficult to control. Taking narcotics to control the pain of cancer or other medical problems does not itself lead to dependence. You may need a pain specialist to help you manage long-term pain. Many people require pain pills because of injuries they have sustained in life. Some of these injuries can be helped with surgery and/or therapy. Some people who suffer from rheumatoid arthritis, cancer, or the effects of cancer, multiple sclerosis, fibromyalgia, and many other neurological diseases do require pain medication. According to Cheryl Ellis at Caregiver Today, caregivers and loved ones may worry that tolerance means addiction, but they are not the same. Over extended periods of time, the dosage of medication may need to be increased because the individual has developed a tolerance to the medication, or there has been a rise in pain levels. Doctors work to use the lowest effective dosage to keep the patient alert and pain-free. Healthcare providers recognize the risk of abuse and misuse and are eager to find a solution while protecting access to these medications in order to keep them in the hands of those who need them. When a doctor wants to put a patient on a pain medication, they may have to have the patient agree to certain terms, such as taking urine tests, signing written agreements about the use of the narcotics, and detailed prescription monitoring. These terms will help the doctor and patient to be both responsible for the narcotics. Patients who take narcotics for long periods of time are usually seen by a physician who prescribes them every 3 months. These appointments help the doctor in making sure the patient is taking the medication correctly. If the patient is having less pain and not taking the narcotics as much, the doctors may start to have the patient taper the use of the pills. This is usually done at a slow pace so the patient can avoid having withdrawal symptoms. Medication dependence occurs when there is a physical reliance on the medication and withdrawal symptoms that may occur. People who have a history of addiction may still need to use a narcotic if they have an injury or a surgical procedure. It is up to them to disclose their history to their doctor, and the doctor will monitor the patient while using the narcotics. They will usually only give them enough to last a few days to help with the early stages of pain. The management of chronic pain is challenging for both patients and doctors. However, it can be done successfully.